Rules of aesthetics have pretty much stayed the same. How we create that, how we communicate that has changed quite a bit, but the rules have stayed the same. First key that I truly believe we have to do is like envision where you want to go with enhancing somebody's smile. You develop that keen eye about all these things that I've had listed here, but you have to have that gut feeling. And I truly believe some patients just don't know. And this is where we can educate them, show our expertise in a very positive way. When I plan a case, I look at, okay, where is the incisal position? And then from the incisal position, I'll figure, okay, where's the gingival level need to be? And then if I know it's, I know where the gum tissue is going to go, and I have to place an implant, you want to have that implant at least at the level of the bone. And more importantly, you want to have it 3 millimeters underneath the gum. If you can spend a lot of time getting into technical stuff, and I think patients need to know that you're really on the same playing field, you're on the same page. They're the president of the show. They make a very logical decision about that, or they want to get jewelry, or they want to get a brand new car that maybe is really, really fancy and stuff like that. They don't make logical decisions. They justify things with logic, but they decide on things very emotionally. So I want our patients to fall in love with our treatment. So, and how do we do that? Well, we got to communicate a little bit more than we used to. So, and we've shifted years ago to communicating more emotionally with people. We do mock-ups on them, so they get a chance to see what it looks like. And I'll show you what I mean by that. And then once they're connected to the idea, the concept of changing their smile, that how much better that they'll look, then we get into the technical explanations. Instead of using my old imaging software, I said, I'm going to go ahead and do it just the way Christian would do. So instead of doing wax, I used composite and create a putty matrix of this and brought my patient in. And here's kind of what she saw. We did a mock-up on her.
Tamara, what do you think?
It's awesome.
Yeah, look at that.
And you can see that she's showing her smile.
How do you feel?
Awesome, except you're going to take them out.
I know, but it's a process. We'll get it all there for you. And
but you can see how
show your teeth when you smile?
Her smile changed. Yeah, I'm not showing the bicuspid. You could see a glow,
forever,
a happiness in her smile.
And everything.
The DSD app, which was great because I could show patients, here's your smile. We could show how we could lengthen the teeth. We could show whiteness. We could show comparison in the left and the right, and really help people get much more motivated. And you want to balance people's smiles, and you want to manage their pink. And the old way is doing things was electrosurge and things like that. Since 2003, I've gotten into more innovative things using lasers. I sound like Dr. Evil, didn't I? And lasers. And but I can do closed flap gum lift, and there's a lot of great science behind that. I don't do tunnel grafting or stuff like that. One of the things I will do is do pink restorative for people. But here's a patient that wasn't happy with her smile. What we treatment planned with her is, how do we create that curvature to her smile? And we could have, moved the gum upwards, or we could go intrude the teeth. And we actually did a combination of both of those. In her case, we had to use erbium lasers to adjust the soft tissue, but also to create adjust the osseous contour. And this is something John Coyce talked about. There is a biologic zone, and most people, 85 to 90% of the time, have thick enough gum tissue and bone that you can adjust the bone very well. So what we did in her case is we adjust the soft tissue, and we obviously did not have a biologic width here. So we went ahead and prepped her teeth, put the temporaries on her, and used her temporaries as a retainer for her, let things settle. And then I went in almost like a perio probe with a laser. This is measured at 3 millimeters. We just very gently adjusted the bone from through here and even into the line angles. That's really, really important to do. again, no, very minimally invasive, no bleeding or anything like that. And she was extremely happy about this. And when you look at it under the hood, you could see that we had this really nice symmetry with 7 through 10. You just look how just nicely stippled the tissue is. Closed flap gum lifts do work. You just have to follow a recipe about that and just be very patient at educating your patients. You've got to do really good diagnostics, and it's got to be calibrated and accurate and have a system to doing it. And I learned from John Coyce years ago that if you think of what we do as like a Rubik's Cube, we have all these different things to be thinking about, risk factors that we deal with. And just so happens there are 6 risk factors and there are 6 colors in a Rubik's Cube. And if you are paying attention to all those things, it gives you a really great chance of solving that Rubik's Cube and giving people long-term results.